We are living through times that require us to wear masks while in contact with others, whether at work or while commuting or socializing. This is to let you know that although you won't see us wearing masks in these animations, we strongly recommend the use of masks as part of COVID-19 prevention measures.
Hello, Farzana. Looks like your cold is still there.
Yes, I always have a tendency to catch a cold during the rains. And my daughter, Afreen, she has got the same from me.
Are schools opening?
No announcement yet. But how shall I take care of Afreen during COVID? And what if both of us get COVID?
Do not worry. Be sure to follow the basic procedures to keep you and your family safe. And touching your face is the wrong thing to do. If you were to get COVID, you would need to follow these steps to protect others in your family from getting it. Wash your hands with soap and water. Use masks and maintain hygiene when nursing a baby. Cover your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately. Teach children to do the same. Avoid touching eyes, nose and mouth so that you protect yourself, and don't spread COVID to others. Stay at home if you or your child feels unwell, even with mild symptoms such as a headache and a slightly runny nose, until fully recovered. If fever, cough, and difficulty in breathing develop, seek medical advice immediately. Stay at least 1 meter or 3 feet away from anyone who is coughing or sneezing.
Did you know that both of our neighbors have COVID?
Oh yes, I heard. If either or both of you and your husband were to get sick, you need to ask for help from others. It is good to identify one person in advance who will take care of your family during an emergency.
It is especially difficult because the wife is 5 months pregnant.
The simple rules of keeping safe during COVID apply for pregnant women too. In fact, I know of cases where newborn babies have COVID. Children often have milder symptoms, but they can still spread the virus.
Interesting. Just curious. How do COVID-positive mothers handle their newborn babies? Is it safe?
Mothers should know that according to the World Health Organization, the benefits of breastfeeding are much more than the risks of transmission. Close contact and early exclusive breastfeeding help the baby to thrive. It is important to breastfeed safely. Use a clean mask. Clean your nipples and breasts before and after breastfeeding with a clean cloth. In case of serious illness, pump the breast milk, store it, and ask someone else to feed the child. Hold your newborn skin to skin. Block the level of contact your newborn has with others by being the only one to share a room with him or her. You should wash your hands before and after touching your baby and keep all surfaces clean.
Hi Roxana. I think I missed your session on family planning the other day.
No worries. I'll be happy to take you through the different elements. Contraception, pregnancy, and nutrition. First, let's take a look at contraception.
I wanted to check one thing. Is contraception safe?
All modern methods of contraception are safe. In case you just had a baby in the last 6 months, or you have a special condition, like diabetes or heart disease, you need to check with a doctor.
So Hale and I are not looking to expand our family right now.
I understand. These are uncertain times, and resources like money, food, medicine may not be easily available or expensive. It makes sense to be sure you feel comfortable expanding your family.
What are the options available for contraception?
There are different types of contraceptive methods. Information from healthcare providers is available either by calling them directly or checking online. Non-prescription based methods like condoms, spermicides, diaphragm, birth control pills, or even emergency contraceptive pills, etc., are available at pharmacies. For any of these methods, check with your doctor.
Are all these easily available? Can I shift from one to another?
Yes, these are normally available, but you always need to check with your doctor.
My cousin Farida uses an IUD implant. Can she remove it in this period?
Yes, but she should not remove it herself. She should seek a healthcare provider to get it removed. If her IUD is expiring, she can use another method of contraception while she waits to have it removed, but she should not forget to get it removed.
Suppose COVID goes on for a long time, and we change our mind, and I decide to get pregnant. What is your advice for pregnant women?
Again, basic principles need to be followed during pregnancy. Eating healthy food like grains, proteins, including eggs, vegetables, fruit, iron and dairy, folic acid-based foods like leafy green vegetables, orange juice, or approved supplements are good in times of pregnancy. What to avoid? Avoid alcohol, cigarettes, cigars, and medicines not prescribed by a doctor. Chemicals like paint, insecticides, etc. should be avoided.
When is the right time to consult a doctor?
As a starting point, call your medical professional to schedule an appointment and get information needed to see them safely during this pandemic. The right times to seek medical help when you are pregnant are usually immediately when you find out you are pregnant, between 4 and 7 months of pregnancy, and between 7 and 8 months.
That's good to know.
There are some emergency symptoms that can occur during pregnancy. Examples of these are excessive vaginal bleeding, water breaking prematurely, or changes in the baby's movement patterns. There are other possible concerning symptoms. So in order to be aware of them, a pregnant woman should make sure to ask her doctor about these during her regular checkups. To stay healthy after birth, take rest, eat healthy foods and water, exercise moderately 6 weeks after birth. In case of complications, call the doctor.
What about nutrition during COVID?
Let's look at nutrition at the different stages of the baby's development. Less than 6 months. Exclusive breastfeeding. 6 to 8 months. Soft porridges and pureed foods from family meals work well for children at this age. Remember, including fruits, vegetables, grains, dairy and protein such as legumes, eggs, and/or meat and fish is key for your child's development. Also, at this age, infants can start drinking water. All of these options make up a diverse and healthy diet. Give the child time to get used to new foods. Be patient in case they're full. 9 to 11 months. Building on this variety of foods that are healthy for a child, at this age, children can now start eating chewable foods, in addition to the pureed foods you've been feeding them. 12 to 24 months. At this age, children can continue eating variety by slowly getting used to eating the same solid foods as the family. Plenty of water is good for mothers and children. However, children that are 0 to 6 months old should only have breast milk.
That is nice to know. Afreen is getting so restless in these times.
Yes, that's so true for all children, including my own. Parents need to listen more, give attention, ensure regular contact in case they are away, and keep regular routines. All that I have said today is something I follow for my own family.
Yes. That's a lot of good advice on parenting.